Today we will be discussing some important aspects of curriculum, assessment and writing multiple choice questions. Right? So this is a small exercise, maybe within 10 minutes or so you will be able to do it. Please do it and then we will continue with further discussions. So what I request you to do is that imagine you are setting a question paper for your students in your subject, whatever subject you teach. Right? And duration of the test is 1 hour and maximum marks is 50 marks and 2 long answer questions are required, 10 marks each, 5 short answer questions are required, 5 marks each, and 5 MCQs are required, which each of them will carry 1 mark each. So maybe within 15 minutes or so you should be able to frame a question paper, right? And after setting a question paper, then you come back to this presentation and then analyze the questions that you have prepared, right? So take your time and prepare a question paper. Now, hope you have all prepared a question paper, and now assess each of these questions that you have written, taking into consideration the following questions. So ask following questions regarding your each question that you have prepared. Okay. So what does the question assess? Each and every question you have to go on asking these questions. Okay. So what does the question assess? For example, does it assess knowledge? Does it assess skills? Does it assess attitude? What does it assess? First question. Second question. Under which of the categories does this topic fall? Core, non-core, or maybe must know, desirable to know, nice to know. Under which category does this topic fall? What level of knowledge does the question assess? Does it assess memory? Does it assess understanding? Does it assess application? Or does it assess analytical skills of the student? So what does it exactly assess? Then does the question fall under the appropriate category as prescribed in the curriculum? In the curriculum, has it been discussed under, or has the topic been described under theory, 𝐻𝐸𝑐, or practical, or short answer question, long answer question, or MCQ? So does this question that you have prepared, does it come under the appropriate category as prescribed by syllabus or not? And finally, if you are unable to give the answers to these questions, you must think of your curriculum. Is the curriculum detailed enough for you to be able to answer the above questions? This is the question that I am asking. Is the curriculum prescribed maybe by the Central Council of Indian Medicine or maybe by your university, whatever curriculum you are following, right? Is it sufficiently detailed enough for you to be able to answer the questions which I have just posed? Okay. For instance, what is must know, desirable to know and nice to know? There will be some topics in your subject which a student must be knowing if he has to pass through the examination. Right? Some topics may be desirable to know, right? And some topics might fall under nice to know category. For instance, let us take the example of maybe blood pressure. Okay. So definition of blood pressure under physiology, right? In the subject physiology or kriya, sharir, the definition of blood pressure, the factors determining blood pressure, right? The definition of cardiac output, definition of venous return, definition of peripheral resistance, definition of heart rate, definition of stroke volume, right? All these topics, they fall under must know category. Okay. But some topics may fall under desirable to know category. Maybe the classification of hypertension. Definition of hypertension may be must know, but after that, right, further classification of hypertension, what is stage 1 hypertension, what is stage 2 hypertension, or what is malignant hypertension, so on and so forth. So it is good if a student knows this classification, but it may not be falling under must know category. especially in first year BAMS, right? And then there could be something like the physiological basis of treatment of hypertension. How do the ACE inhibitors act? How do the calcium channel blockers act? How do the beta blockers act? At which level do they act? Right? So these may be the questions, or these might be the topics that fall under nice to know category. Right? If a student of first year BAMS studying physiology or kriya sharir knows these things, it is good. But it is not essential to know. Right? But the same thing might become essential to know or must know when he studies 𝐻𝐶𝐞𝐜 or medicine. Right? For him, the classification of hypertension, he must be knowing. Right? Or maybe the different classes of drugs that act at different levels. Right? That are useful in the treatment of hypertension. Maybe he must be knowing this. Right? So depending on the subject, certain topics might fall under must know category, some of them might fall under desirable to know category, and some of them might fall under nice to know category. But this kind of classification should be there in the curriculum. Curriculum should specify, whenever there is a list of topics, each topic, before each topic, it should be specified whether this topic falls under must know, desirable to know, or nice to know category. So must know is also known as core competency or core area, and desirable to know and nice to know might fall under non-core categories. This is another way of classifying, right? So my question is that whether you are able to answer these questions regarding the question paper that you have prepared. If no, it means that there is something wrong with the curriculum. Your curriculum is not good enough for you to be able to answer these questions regarding the question paper that you have prepared. Am I clear? Right? Now, there are several misconceptions regarding the curriculum and syllabus. Curriculum is not equal to syllabus. Syllabus is a part of curriculum, but curriculum is something more than syllabus. What the Central Council of Indian Medicine prescribes, right, is syllabus. It is a syllabus, right? It is not a good curriculum. Why it is not a good curriculum? Because curriculum should ideally cover all components of training intended to be delivered. It should include the goals of the program, the goals of the course or paper or subject, goals or learning objectives, desired level of competencies to be achieved, suggested teaching learning methods, assessment methods, etc. Everything should be specified in the good curriculum. A good curriculum should contain all these details. It should also include intended levels of knowledge, skills, attitude to be imparted to a student during the entire course or during the entire program. It must also spell out under which category does a specific topic fall. Does it fall under must know, desirable to know, or nice to know categories? So if all these answers or all these descriptions are available in a good curriculum, then only it can be called a good curriculum. Otherwise, it is simply a list of topics. Most of our subjects, they are simply syllabi. They are not the curricula. Right? So, in 1978, Abrahamson, he described some problems with the common problems that affect curricula, especially in the medical stream, right? In medical colleges. He did a good study and then he assessed and he described some common problems that affect the curricula. And he named these diseases in some funny names, using some funny names, but they are not actually funny. Each one has got some specific meaning. For example, he says curriculosclerosis. What is sclerosis? Like arteriosclerosis, hardening, right? Hardening means compartmentalization, very strict compartmentalization, departmentalization, right? This topic should fall under only this subject, right? It cannot overlap with the other subject. This is called compartmentalization, right? Extreme form of departmentalization. This is called curriculosclerosis. Then comes carcinoma of curriculum. What is carcinoma? there is excessive uncontrolled growth of some tissue, one particular tissue, right? Similarly, in the entire curriculum, there is excessive growth, excessive expansion of one particular topic. Maybe because of several reasons. Maybe in the recent years, some topic might have received some extra attention and might have become popular. So that particular topic goes on expanding as the syllabus gets revised every time. This is called carcinoma of curriculum, right? Uncontrolled growth of one segment of curriculum over a period of time. Then curriculoarthritis. Arthritis is related to joints, right? There is a problem with the joints. Joint means connectivity, right? There is disconnectivity or lack of connectivity between the different segments of the curriculum. For instance, in our Ayurvedic subjects, most of the curricula, they have got this problem because Ayurvedic component is dealt with in a separate paper. The relevant modern subject is classified under a different paper or different section. There is no links between the same topics. Maybe 𝘊𝑆 should be taught along with the maybe cardiovascular system. Then only the understanding of cardiovascular system and 𝘊𝑆 becomes more clear to a student. But unfortunately, in our syllabus, cardiovascular system is separate in separate a paper, separate section, whereas the 𝘊𝑆, 𝑅𝑎 and other things are in a separate srotas, right? Or I mean section of the syllabus. There is no connectivity or connecting link. This is called curriculoarthritis. Curriculum dysesthesia, widespread conviction that something is not quite right with the curriculum. Something is wrong with the curriculum. Everybody knows that there is something wrong with the curriculum, but nobody is aware of exact problems that are affecting the curriculum, right? This is called dysesthesia. Then iatrogenic curriculitis. Iatrogenic means induced by the physician. It is here in this case induced by the teachers and academicians, right, who are also the medical teachers. So too much of frequent meddling with curriculum before it can be evaluated. When a good or bad, whatever curriculum is prepared, then sufficient amount of time needs to be given for it to be implemented, and then it has to be evaluated. But if you see the history of curriculum reviewing and restructuring over the past few years which has been done by Central Council of Indian Medicine, very frequently the syllabus and curricula has been changed, right? Over the past 10 or 15 years, at least 3 or 4 times the syllabus has undergone reviewing and restructuring, right? So what problems does it create? It creates a major problem that we are unable to assess whether the curriculum is good or not. We do not give time for the evaluation of the curriculum, right? Curriculum also needs evaluation, and then only based on some ground level realities, then only the curriculum needs to be updated or revised. But without doing any such exercise, if you go on revising and restructuring the curriculum, this is called iatrogenic curriculitis. Then curriculum hypertrophy. Experts of each branch tend to add new information to the curriculum. Every expert wants to add some areas of his interest or her interest in the curriculum. And thus, curriculum goes on becoming larger and larger. This is called hypertrophy, right? Then idiopathic curriculitis. Idiopathic means we don't know what is happening actually, but there is something wrong. No specific cause, but curriculum is blamed. And in such cases, what is actually wrong is with the teachers, right? They don't teach properly, but ultimately they blame the curriculum. The curriculum is not good, right? Is what teachers say when they do not teach well, right? This often happens. Then intercurrent curriculitis means incompatibility of the curriculum with the current societal problems, right? In the current societal in the current society, the need may be different, but your curriculum might be teaching you something else which is not required and not relevant at all, right? This is called intercurrent curriculitis. It is not current, right? It doesn't supply the current needs or relevant information which is relevant to the contemporary times. Then curriculum ossification. Ossification means once the bones are ossified, then there is no growth, right? Similarly, sometimes what happens is, many feel that curriculum is complete. There is nothing to change. In my subject, what can be changed? There is nothing that can be changed. This is a very common attitude among many teachers, right? My syllabus or subject of my subject, the curriculum of my subject is already complete. It is good. It is best. No modification is required. So this kind of attitude is called resistant to any change and modification and improvement in the curriculum. This is called curriculum ossification. See, if you understand these diseases, then you will be probably able to design a good curriculum when you get such an opportunity. Maybe in future, you might be asked to do or design a good curriculum. And then in that case, you must be knowing what is the right way of designing a curriculum, right? So there is something called knowledge, skill, attitude framework. Again, this is based on Bloom's taxonomy, which we will be discussing later. Again, whenever learning takes place, right, the learning happens in 3 domains, or it can happen in either of the 3 domains, right? Either it could be knowledge, or it could be skill, or it could be attitudes. See, whenever there is learning, ultimately some change has to happen in a student, right? Maybe in knowledge domain, maybe in skills domain, and maybe in attitude domain. What is knowledge? Cognitive or mental abilities to retain and process the information. That is called knowledge, right? Learning the facts, ideas and concepts, right? This is called knowledge. So cognitive domain. So typically these are the verbs that are used to discuss or describe the knowledge domain, like defines, lists, enumerates, describes, explains. Now if you go through the question paper that you have designed, see how many times you have used these terms. Define the following, discuss the following, describe the following, explain the following, right? These are the very commonly used terms. It means you are assessing knowledge. You must be knowing, whenever you use some specific verbs, you should be knowing what you are exactly going to assess. Similarly, skills mostly refers to physical abilities used to perform activities or tasks. Learning how to do something, right? It is also called psychomotor domain. For example, performs, does, shows, records, etc. Right? For example, in the practical classes or practical examination or clinical bedside examination, what you do is you assess skills. That is why we have got different types of examination patterns. In theory, mostly we assess knowledge domain. In practical examination or in clinical examination, we assess skills. Show how do you palpate the liver, right? Show how do you do straight leg raising test, SLR test, right? Show how to prepare a blood smear, right? Show how to draw the venous blood. Show how to focus the slide on a microscope. All these fall under the skill domain. That is why you have got practical examination. Unfortunately, often teachers do not know the difference between practical examination and theory examination. They go to the lab and ask the same theory questions in the practical examinations also, right? If you have asked your student to do some practical, maybe RBC count, or maybe WBC count, or maybe differential leukocyte count, you should not go and ask the normal percentage of maybe lymphocytes or neutrophils. Instead, you should ask him to do and show how did he identify a neutrophil, how does he focus the microscope, how does the illumination system work, right? You should ask him to change the objectives and then focus. How you should know how does he manipulate the condenser, how does he use the oil immersion microscope or objective, right? See, these are the things that you should be assessing during practical examination. You should not ask the theory related questions in the practical examination, usually, right? That is not the purpose actually, right? Then comes attitudes. That is why to assess attitudes we have got 𝑌𝐸. Again, in the 𝑌𝐸 often what we do is we go on asking the theory questions. But actually what we need to assess is maybe feelings, emotions, values about something, maybe learning to form a new or different viewpoint or belief, right? That is called affective domain. Maybe communication skills. You should assess the communication skills, right? Feels, expresses, distinguishes, right? These are the things which you should be assessing, right? See, in theory, student may be knowing the importance of palpatory method. But if you ask him how do you record blood pressure in the patient, right? Then he might skip that palpatory method. That shows how negligent he is or she is, right? Though he may be knowing, but negligence is not a good attitude, right? So these are the things that you should be assessing during the 𝐻𝐸𝐫𝐞, right? So that is how there are three domains of learning, right? Knowledge, skills and attitude. Then Bloom's taxonomy was designed in 1956 under the leadership of educational psychologist Dr. Benjamin Bloom in order to promote higher forms of thinking in education, such as analyzing and evaluating concepts, processes, procedures and principles rather than just remembering the facts. Right? Most of us, what we do, we just emphasize on recall component, memorize, right? But we do not often assess higher order thinking skills, right? So he designed a pyramid. This is the pyramid that is called Bloom's taxonomy, right? First one is remember, second is understand, third is application, fourth is analysis, fifth is evaluation, and lastly it is creation, synthesizing something new, right? So remembering is recalling the facts, right? Enumerate, classify, right? Define. All these are the verbs that are assessing actually the recall component. Then understand, explain the ideas or concepts, description, right? Compare and contrast. All these falls under the understanding category. Then apply, use this information or knowledge in new situation. That is called application, right? Application means he has the knowledge, he or she has the knowledge, but he or she should be able to apply this knowledge in a new situation. That becomes application. Then analysis, draw the connections among the different ideas, right? This is called analysis. Then evaluation, a standard, justify a stand or decision. This is called evaluation. I'll be giving some examples, right? Judge, argue, defend. These are the verbs that define evaluation. And finally, create, design, assemble, construct, conjecture, develop. These are the verbs that define the creation or synthesis component, right? So there are different components of Bloom's taxonomy, and the remember and understanding, they are mostly called lower order skills, and above that, right, apply, analyze, evaluate and create, they are considered as higher order thinking skills, right? So knowledge involves the recall of specific and universals, the recall of methods and processes, or the recall of pattern, structure or setting, and define blood pressure, define stroke volume, right? What is the formula of a body mass index, right? According to Charaka, right? What is the classification of some disease? According to Sushruta, right? How many 𝐵ेदव्याधीs are there, �ഛेदव्याधीs are there? And see, these are the examples, right? Which often assess knowledge component. And then comprehension means refers to the type of understanding such that individual knows what is being communicated and can make use of the material or idea being communicated. Is, according to Ayurvedic classics, 𝑉𝑅𝑘 associated with the water and electrolyte balance or not? If this is the question, then the student must think and connect different components, whatever he knows, right? This is called understanding. Simply recall will not help him or her to answer such question. Then third is application. Use of concepts and understanding in a specific new situation. In a new situation, how do you apply it? Right? This is called application, right? Assess a prakriti of a given individual now, right? Then that becomes application, and also prescribe the right kind of dietary prescription pattern or maybe lifestyle measures in this particular person, right? After assessing prakriti, that becomes application. You have got a new person in whom you have to apply the knowledge of prakriti, and then you have to prescribe the lifestyle and diet. Okay? Then analysis, breakdown of information into its constituent elements or parts such that the relative hierarchy of ideas is made clear and or the relations between ideas expressed are made explicit. So analysis is either breaking down the different components of a same concept or theory, or maybe giving links between different components of an idea. Right? Synthesis, putting together of elements and parts so that to perform a new whole, right? Synthesize or to create. See, the last two levels of Bloom's taxonomy, that is synthesis and evaluation, are often modified, right? Either sometimes it is written as synthesis as 5th level and evaluation at the 6th level, and some modifications, right, have been done, and some people they argue that no, synthesis should be the last and evaluation should be the 5th level. But we won't go into these details, right? For us, even synthesis and evaluation, both of them are higher order thinking skills, right? So evaluation means judgment about the value of material and methods for a given purposes. Maybe you have got some data, right, research data, and you have to evaluate it by interpreting it, right? That becomes evaluation, right? Maybe you should know what's the meaning of p-value, right? What is the meaning of confidence interval, right? And then you should be able to interpret the meaning, maybe association between two things. That is how evaluation is done. See, we shall take one example and then we shall see how to frame the questions to assess different levels of thinking skills. Right now again, you compare the questions that you have created, you have formed during the initial phases of our exercise, right? You framed a question paper. Now you think about those questions and assess what do these questions assess, right? Now, for example, if I ask, write the correct formula of calculating BMI, body mass index. So what does it assess? It assesses only recall, right? Weight in kgs divided by height in meters squared. So if he knows this formula, he will get full marks, right? This is first level, that is recall. Second level is height of a male individual aged 50 years is 160 centimeters and weight is 80 kilograms. Now what is his BMI? See, in this case, student should know the formula. He should also know how to convert centimeters into meters, then how to square it, and then the calculation he should know, and then only he will be able to give the correct answer, right? This becomes understanding. Now you are assessing understanding level, right? Third, under which of the following categories does this individual fall? Underweight, normal, overweight, obese. Now he should know the normal range of BMI, what is underweight or undernourished, right? What is normal range, then what is overweight, and when you call a person to be obese. You should know it, and under which category this particular person falls, he should be able to make out. That becomes application, third level, right? Okay. Then if this person is a known hypertensive and has impaired glucose tolerance, what further investigations and lifestyle modifications do you suggest? What would be the possible diagnosis? So this question is again further higher order, assesses further higher order thinking skills, right? It is analysis, right? You are analyzing something by using several information, several parts of information. You are trying to connect those information, those pieces, and then you are analyzing it. How to interpret a data set of 100 obese individuals with varying BMIs in relation to their eating habits? Maybe there is a table. I give you a table, right, containing some data of 100 obese individuals, and also there is data containing their eating habits, right? And then some statistical data I will be giving you, right? That means you will have to, the student should be able to draw the association between eating habits and obesity, right? This becomes further higher order thinking skills, right? This is the evaluation actually. And creation is, how do you form a research question to look at the association between obesity and average daily screen time? Screen time means the number of hours you spend before your mobile phone, or maybe before your PC, or maybe before your television set, right? All this falls under screen time, right? So you assess the screen time of per day, right, of these individuals, and then you also assess the BMI, and then you try to draw the association. So how do you frame a research question, and how do you frame a study, right? What kind of study you will do, whether you will go for observational study, whether you will go for a survey study, whether you will do some experiment, right? So all this depends on your higher order thinking skills, right? So this is how, by taking one simple example of body mass index, you can do or assess different levels of higher order thinking skills. And that is how a good curriculum should be aimed at, and that is how a good question paper also should be aimed at, right? There have to be some questions which should assess recall, and then understanding, then analysis, application, analysis, right? So all these kinds of evaluation or questions should be there in a good question paper. And now again go back to your question paper and then assess how many questions that you have asked fall under recall category, understanding category, application category, analysis, and so on, right? So recently Medical Council of India has come up with a new syllabus or curriculum for MBBS course or program, and it is called competency-based curriculum. It is also known as outcome-based education, or outcome-based assessment, right? So you not only describe the syllabus, but also you describe the curriculum and each component. What is the level of competency that needs to be achieved? It is specified in the curriculum. That becomes a good curriculum, right? So curriculum that emphasizes the complex outcomes of a learning process rather than only focusing on what learners are expected to learn in terms of subject content. This is called competency-based curriculum. Such a curriculum is learner-centered and adaptive to the changing needs of students, teachers, and society. Okay? So it is very extensively done homework and very well done syllabus or curriculum, and one has to go through these curricula of MBBS program, and then I think we also need to incorporate those aspects of curriculum in our Ayurvedic programs as well, maybe BAMS, maybe MD, right? It defines what is expected out of a clinician, right? Clinician should be the one who understands and provides preventive, promotive, curative, palliative, and holistic care with compassion. He should also be a leader after the completion of the MBBS program, right? This is what one is expected to become, right? He should be a clinician, he should be a leader and member of healthcare team and system with capabilities to collect, analyze, and synthesize and communicate the health data appropriately. He or she should be a communicator with patients, families, colleagues, and community. Lifelong learner, committed to continuous improvement of skills and knowledge. Professional, who is committed to excellence, who is ethical, who is responsive, and who is accountable to patients, community, and profession. See, these are the attributes which have been very well defined in the curriculum of MBBS, right? When it comes to medical education, there is another framework, and it is called Miller's pyramid, just like Bloom's taxonomy, right? Bloom's taxonomy is mostly used in general education, right? But in medical education, because it involves patient care also, right? There is one more taxonomy or pyramid which is called Miller's pyramid, a framework, where it has been classified as the assessment or maybe even training should be classified as knows how, shows how, and does. Does means also performs. Knows, for example, fact gathering, right? What is blood pressure, right? What is blood pressure, or what is prakriti, okay? What is dhatusara? So this comes under knows, lowest level of competency. Then knows how to assess prakriti, how to record blood pressure. That becomes knows how. Then shows how. He does record. He records the blood pressure in a given individual. He assesses prakriti in a given individual. That becomes shows how. And then does, right? In a patient at the bedside, he goes and records the blood pressure, he assesses the prakriti, and then maybe classifies the hypertension, maybe prescribes the dietary intervention or lifestyle to a new individual, right? In an actual clinical setup. That becomes performs or does. So these are the 4 levels of competency which Miller's pyramid suggests. Let us take some examples. For example, suturing, right? Classifies the different types of sutures, right? This means he knows the classification of suturing. Then compares the advantages and disadvantages of continuous suture and interrupted suture. Again, he knows the differences, right? Describes the logic based on which the kind of suture is decided in different situations. Again, knows the basis on which kind of suturing is to be preferred in a given situation. Now, decides the kind of suture preferred in a specific new situation. For example, the repair of vaginal tear after the childbirth, right? Knows how, right? In which situation, what suture has to be done and how it has to be done. Shows how, demonstrates the method of applying simple continuous suture on a simulation skin sheet. Just like the Yogya Vidhi, right, in Ayurveda, right, in Sushruta Samhita, he has described the using of different models or dummies to experience or to train the student in different surgical techniques for 𝐻𝑒dy𝑎, 𝐵𝑒dy𝑎 and other things, right? For all such Sivana, all these procedures have been suggested to be taught using these models or dummies. Similarly, even in modern medical practice, in training, these kinds of simulation, maybe skin sheet for example, such things are used to teach the right method of suturing. How efficiently one can evaluate the condition, decide the right kind of suturing and technique and apply the suture. This is actually performed in a new situation, in a given patient, right? He or she should be able to decide which kind of suturing has to be done, why it has to be done, and how it has to be done, and does it. Not only knows, he or she does apply the correct kind of suture that is required in the situation. That becomes performs. So this is how the different levels of competencies are described.